Well, good afternoon. I'm pleased to report that we're making steady progress in our mission to get needles in people's arms. Today, we will reach an important milestone in our battle against COVID-19. By the end of the day, we expect to have administered our 1 millionth vaccine dose in Ontario. That's 1 million doses. Let me take a moment to thank the Vaccine Task Force and all of their hardworking frontline healthcare workers for this incredible achievement. And I want to thank all the volunteers here at the Toronto Congress Centre for their work at this mass vaccination clinic. Clinics like this are playing a vital role in our provincial vaccine delivery plan. We will have more than 120 new mass immunization clinics open by the end of the month, giving us the capacity to deliver up to 150,000 doses a day, dependent on supply from the federal government. This is an absolute game changer. It appears that our vaccine supply is continuing to improve. Yesterday, we received 194,500 doses of the AstraZeneca vaccine. To get these vaccines administered as quickly as possible, more members of Team Ontario are stepping up. As of Friday, over 325 pharmacies will begin offering the AstraZeneca vaccine to Ontarians between the ages of 60 and 64. In fact, some pharmacies started administering vaccines this morning. This vaccine pilot will begin in 3 PHUs, including Toronto, Windsor-Essex and Kingston, Frontenac, Lennox and Addington. For those eligible, you can find a list of participating pharmacies at ontario.ca/pharmacy COVID vaccine. In addition, primary care professionals will be offering vaccinations in primary care settings and community locations such as physician offices beginning this weekend. They will be contacting eligible Ontarians aged 60 to 64. This expansion will start with Hamilton, Toronto, Guelph, Peterborough, Simcoe, Muskoka, and Peel. My friends, the light at the end of the tunnel keeps getting brighter. Please be patient. We will get through this. Thank you, and God bless the people of Ontario. Now I'll hand it over to General Hillier.
Well, Premier, thank you, and my update will be fairly quick. We are going to hit 1 million doses in the arms of the people of Ontario today. In fact, I'm convinced that right as we stand here now, we've already passed that mark. We'll see by the count this afternoon. And I want to echo what the Premier said to thank those people who are involved in the vaccination rollout. There are tens of thousands of them across the province who are engaged in this all-consuming mission to give the people of Ontario the level of protection that we want them to have against COVID-19. Whether that's the people who deliver the vaccines to the airports, the security that ensure it gets to where it has to go, the people who receive it there, the folks who organize the clinics, the volunteers that show up, the logistics parts of it, the folks who do the IT and make sure people can get a vaccination appointment and get in to get it, and then those people who put the vaccine into the arms of those who are there to receive it. There are literally tens of thousands of them, those who do the planning, those who do the communications for it, and all of them have a role to play, and they're going to remember this role for the rest of their life. And I want to say thank you to every single one of them. 1 million needles in the arms of the people of Ontario as of today. Then secondly, in the next 3 weeks, we are going to do another million into the arms of the peoples of Ontario, and by the end of March, we will have completed that 2nd million, and a little bit more, of course, because we will be using the AstraZeneca. And across Ontario, as the Premier said, clinics like this one are starting up now every single day, getting ready to turn on or turning on, getting ready for the big doses that will arrive a week and a half to 2 weeks from now, and making sure that we can put them efficiently and fairly into the arms of the people who are eligible and who want them. There are 3 starting next week, including this one here in Toronto, as the City of Toronto and Toronto Public Health already announced. We have 6 more starting next Monday in Peel, as the Medical Officer of Health walked me through last night, and that continues right across the province of Ontario. We're going to do another million in the next 3 weeks, and then we'll go onwards and upwards from there. On Monday of next week, our customer service desk and the online booking system will go live. And I know almost every system that's gone live across the country, across the world, in fact, has had challenges. Undoubtedly, we will have some but the work has been done to ensure that those challenges are going to be minimized, and if they are encountered, we will fix it and get back online. I ask all of you to give us a chance to roll that out. If you're not 80 years old on Monday, or if you're not representing somebody who's 80 years old or older, please do not call the customer service desk. Do not go online to check what's there. And if you're in the media, stay off those sites and give people who are trying to get a vaccination appointment an opportunity to actually do so. We will go live on Monday with the customer service desk and the online booking system. The pharmacies and the family doctors have started with AstraZeneca as of today. The details are out there to be found. Each pharmacy handles it slightly differently, but their capacity to help us bring those vaccines to you is absolutely immense, and it is a wonderful thing to watch. I have gone through, starting yesterday and carrying on today and tomorrow, going through with every one of the 34 medical officers of health, their plan on how they are going to implement our provincial plan, what they are doing to ensure they have the capacity, the last sort of coming together before the big wave of doses hits, and to ensure simply that we're ready. I have confidence that we are, but I'd be able to visualize with each of those medical officers of health their plans and be able to ensure that they've got the people to do it, that they've got the sites to do it, that they're prepared for it, and if they need help from the province and or the task force, then the government officials can provide them that help. We're in a really good position to be ready for that onslaught of vaccines, and as I said, in the next month, we will do another million. And I think I'll finish there with my update by saying thanks again to the people who have been so absolutely incredible, getting those vaccines in the arms of people. Every single one of you has been engaged. We have a debt to you. We have an appreciation that we want to show to you that's absolutely incredible. I couldn't be more proud just to be a tiny little part of that awesome team, and thank you for the work that you have done. And to all of the people of Ontario, those vaccines are coming in the short term as you wait for them. Please be a little patient, and please follow the health measures and make sure that we don't give COVID-19 virus or any of the variants an opportunity to surge again whilst we get the vaccine to you as quickly as possible. Thank you.
We'll go to the phone line for questions. First question, please.
From Sean Jeffords at the Canadian Press. Please go ahead.
Hi, Sean.
Good afternoon, Premier. I wanted to ask you about the move to roll the shots out in primary care physician offices. We spoke with the OMA yesterday, and I think we're left with the impression that this was not just, it wasn't ready yet, and that they were kind of operating a bit in the dark when it came to this plan. What's changed in the 24 hours since we spoke with them that would give you confidence that this is going to happen Saturday and people are going to get those shots in doctors' offices?
Before I hand it over to the general, first of all, the primary care physicians, they've done an incredible job out there. I want to thank them. And they have an opportunity to get vaccinations into people's arms, ages 60 to 64. They're the ones who have the patient list. And I have all the confidence in the world they're going to do an incredible job. I'll pass it over to General Hillier.
Sean, thank you for the question. Nothing happened yesterday to change what we've been doing with the OMA and the Nursing Association of Ontario. We ran a tabletop exercise on Monday of this week to walk through how the family physicians and primary care professionals could be utilized. They have been all along in a variety of ways and manners in public health units across Ontario, whether that's part of mass vaccination clinics or whether that's part of teams that go into long-term care homes. Now we're moving a step further where primary care professionals and family doctors will form clinics on their own, mini mass vaccination clinics, if you will. They will continue to work as those teams that go out to populations that cannot come to vaccination sites, and they will continue to support the vaccination rollout in their public health unit. And this week, we're starting with a pilot project on doing those mini mass vaccination clinics by using AstraZeneca. We've walked through that with the OMA. We did a tabletop exercise with them. We're flowing those vaccines to those people in the pilot project, as the Premier mentioned earlier, literally as we speak, and they will start doing it. And then we'll expand it across the province as more and more vaccines arrive. So we've been working with them for quite a while now to do it. Thank you.
Follow-up?
Premier, I'm wondering also about the pharmacy rollout here and the booking through the pharmacies themselves. I mean, is there something in the mechanism where you book to prevent people from booking multiple appointments and kind of playing the odds to ensure that they get a shot? and frankly creating problems when they don't show up for these other appointments that they've booked. Is there some safeguard to prevent that?
Well, again, I'm going to pass that over to the general, and he's been dealing with the pharmacies directly. But the good news is we're going to have excess of 300. I think it was 360 across the province. We're going to ramp that up. There's 4,900 pharmacies in the province. Not all 4,900 will be involved, but the vast majority will. And they're going to play an absolute critical role in making sure that we get needles into people's arms. And I just want to thank the pharmacies, especially the independents, and then the large ones, the Rexalls and the Shoppers and the Walmarts of the world. So I want to thank each and every one of them.
Premier, thank you. Premier, thank you, and thank you for that question. And yeah, once you book an appointment, you will not be able to book a second. There's a system in place to actually do that based on address and postal code. It won't be perfect, so I'm sure we'll find examples of those who have done that. All I do is encourage you to book one appointment. There are going to be vaccines enough for all of us, and they're going to be here very soon. Book one appointment, and don't try to diminish the opportunity that your friends and your family and others could have to get their vaccine also by clogging up by trying to book more than one appointment. I spoke last Friday when I was with the Premier about the impact of the extended interval, up to 4 months between needles for Pfizer and Moderna and AstraZeneca, and what an impact that has on us. And I said then, you know, the first day of summer, the 20th of June this year, that we would have enough capacity and enough vaccines that are forecast to us to be able to put a needle in the arm of every person in Ontario who is eligible to receive the vaccine and who wants to receive it. So we're talking 3 months here to be able to get the vaccination rollout complete for the first needles with that incredible level of protection that brings. So don't clog up the system, even if you find a way to do so by booking a second or a third appointment. If you book one, you'll get your vaccine. Thank you.
Next question.
From Brian Lilly, Toronto Sun. Please go ahead.
Hi, Brian.
Good afternoon, Premier. I'd like to hear specifically from you on this and then from anybody else that wants to weigh in.
Sure.
Cole Pinnow, the CEO of Pfizer Canada, or president of Pfizer Canada, told the Commons yesterday that NACI did not call him or anyone at the company when it came to moving the dosage interval from 3 weeks for Pfizer up to 16. Other prominent physicians have come out and said that we shouldn't be doing this. There's risk. While I understand why you're doing it and generally support the idea, I'd like to hear what your thoughts are on the risk, in particular for vulnerable populations, say over 70s. Have you had conversations about the risk that extending dosage intervals from the recommended 3 weeks to 16 actually brings?
Well, we're following what we heard from NACI. I can tell you I personally have not talked to Cole since the time I called him up and really let into him about getting more vaccines, but I haven't talked to him since then, and I'm going to hand it over to the Minister of Health. She'll have more information on that.
Well, we are following NACI's recommendations, but there are some populations where we are going to stick to the original dosing intervals. People in long-term care homes that have already received the first dose, they will receive the second dose in the lower period of time. But for others, we have been advised by NACI that it is safe and effective in order to be able to extend the dosing intervals for up to 4 months, although with the quantities of vaccines that we are expecting to receive in the next short while, we doubt that there will be that many people that will be extended by those 4 months because we will have significant supplies coming in.
Follow-up?
Premier, we're at the 1 year mark for COVID kind of taking over our lives, from being something that we watched on the news to being something that we all lived every day. And stay-at-home orders, lockdowns, all of that. I've spoken to your opposition critics and others who have told me how they think you've handled the last year. I'd like to get a sense from you. Where do you think your government did the right thing, and where do you think that you and your government dropped the ball?
Well, first of all, I've always said it's not about me. Yes, we at the end of the day, the buck stops with us, but it's all the great work that everyone pulled together. I remember that day. I was in Ottawa, and we said that we were closing down the schools, but no one ever anticipated it would go to this extent. And it was just amazing. And I can tell you, Brian, I've never been more proud to be Premier of a province of Ontario when I saw everyone band together, and we had one hurdle after the other hurdle after the other hurdle, and this was all new to the world, not just Ontario. Where I wish we could have done something different is with collaboration, getting a company to produce the vaccines with the federal government. But I never want to be left relying on foreign governments or foreign leaders ever again. I want to make sure that we're self-sufficient. I want to make sure that we manufacture vaccines here. We have the know-how, we have the expertise, and we're going to do it. We're going to make sure we have a company that manufactures it. God forbid this happens again. And the vaccine company that will be producing vaccines can also produce the cancer vaccines, produce booster shots. There's all sorts of different vaccines. We could rely on them. But it's been quite a challenge. But what I can tell you, Brian, our team, we've not stopped. There isn't a day, and I'm being 100% frank with you, I have not taken a day off in 365 days, and we're going to continue. We have no choice because we see the light at the end of the tunnel. We will get through this, and I'm just so proud of everyone in Ontario for pitching in.
Next question.
From Rob Ferguson, Toronto Star. Please go ahead.
Hi, Rob.
Hello, everyone. I'm just wondering, now that we have the family doctors, the primary care physicians factored into this, how many doses are they getting out of this 194,500? How many are going to the collectively 325 pharmacies? On average, how much is each pharmacy going to get?
Yeah, really good question. I'm going to have to pass it to the general on that. Thank you.
Rob, thank you. There's been an allocation to the family care for the pilot, to the primary care and family doctors of 29,500 going to them. Literally, as I said, as of today, the rest are going to the 300, and I believe the exact number is 327 pharmacies, and they will have that allocation divided down to them. We believe that their flow-through rate is probably about 40 per day, so the allocation going to each pharmacy is based upon that until, of course, all 194 between those pharmacies and the family doctors have been allocated and sent out, and again, that is happening today. So 194,000, 29,500 to the family doctors, primary care professionals, the remainder to the 327 pharmacies across the 3 public health units, and then with the next shipments coming in, when we know when they are coming and what their numbers are, we'll expand that program right across Ontario.
Follow-up?
Thanks, General. I'm just wondering, in terms of the primary care physicians reaching out to the 60 to 64-year-old patients, on what basis are they doing that? Are they supposed to prioritize it, perhaps for people in that age group who have some of the underlying conditions that could put them more at risk of COVID-19, of severe outcomes, or have conditions on that list of specified conditions that could make people eligible early? How is that being decided, or is it just up to the family doctors to call whomever?
Well, the family physicians know their patients better than anyone, and they understand who needs it a lot sooner than other patients, and I think they'll do a great job in number one, getting their patients to the offices, get vaccinated. But Rob, I think they understand who needs it first in line.
Next question.
From Logan Turner, CBC News. Please go ahead.
Hi, Logan.
Thanks for the question. Premier Ford, you said at the beginning, light may be getting brighter, but that doesn't seem to be the case for people in Thunder Bay. New COVID-19 cases are spiking. Political community leaders have been asking for help for weeks. The Thunder Bay District has the highest per capita number of new COVID cases in the province. Our medical officer of health this week said COVID is everywhere in the community and spreading. What is the Ontario government going to do right now to help this district? Are further supports or restrictions coming?
Well, we won't hold back on anything they need. We'll be up there, and we are supporting them right now, but the best person to answer this is the Minister of Health. Thank you.
Thank you. We're certainly well aware that there's a very difficult situation with COVID cases in Thunder Bay. We are working with the local Chief Medical Officer of Health there, as well as with the federal government. I had a discussion with Minister Haidu about Thunder Bay yesterday, and so they are providing some supports, as are we. We have sent in an additional case and contact managers and people to do the follow-up to help support, as well as some of the public health units that aren't particularly as busy with COVID right now, that they can provide some support by phone as well. We have also put several $1 million into the local hospital to add more beds in case they reach capacity. We want to make sure that people, if they do need to go to hospital, can be cared for locally. We don't want to see people being shifted around across the province because the distances there are so great. We know that it's really important for people to be close to family members, at least to be able to receive that support from them at such time as they are able to be released. So we are aware of what's going on. We are providing supports both in terms of increasing hospital capacity, but also providing people on the ground to help contain the spread and follow up with the case and contact management. We also do know that the outbreaks that have happened in the correctional facility and in the jail are coming under control, but there still is a significant outbreak in homeless shelters and some areas of congregate living. That is another issue that we're turning our attention to and providing additional supports.
Follow-up?
I didn't hear Thunder Bay included by the government as a list of the places of hotspots for COVID-19, despite it having the highest number of cases per capita. I'm curious, why not, and will it be receiving extra doses of the vaccine?
Hand it back.
Well, what we'll be dealing with in terms of the allocation of vaccines is going to be on the basis of population size primarily, but also based on risk. So we want to make sure that we can get to the people over 80 first of all, but also if there are outbreaks and there are those sorts of problems, once we've identified a number already, but we know that there will be more that will happen as we get through the whole vaccination process. And in those situations, additional vaccines will be sent to help deal with that.
Next question.
From John McGrath, TVO. Please go ahead.
Thanks. Another question about Thunder Bay for the health minister. In British Columbia, they are opting to vaccinate every adult in Prince Rupert, one of their northern communities, by April 1st. That seems like the kind of thing that might work in the case of Thunder Bay, another northern community with a really major outbreak. Is that something that the province is considering, and if not, why not?
No, we are considering that. In fact, we've already had Operation Remote Immunity that has already been to 31 fly-in communities in Ontario and also in Moosonee to make sure that all First Nations adults that wish to receive the vaccine can receive it. And we're also looking at doing that as a matter of as one of the risk categories. We want to make sure that all First Nations adults can receive the vaccine because we know that they are more vulnerable. So it is something that we are in the process of putting into action.
Follow-up?
Thank you. And I guess this is more of a broader question, maybe not for the health minister, but Thunder Bay also annually plays a role in usually hosting evacuees from remote First Nations in the case of flooding, other emergencies. At the moment, that would seem to be really dangerous. Is there any kind of planning by the government in terms of making alternate arrangements in terms of where evacuees might go?
Well, first of all, are you talking Orange? I didn't catch the very first word you were saying.
Just in general, Thunder Bay has played a role hosting evacuees from remote communities in terms of flooding and other things. This happens more or less every year now.
No, I understand. There'll be other communities that will be able to transport folks if there's a crisis up there. We've always relied, and first of all, before I answer that, I want to give a shout out to Orange. They've done an incredible job in the 31 remote communities, and they're always on hand to help out. The best person to answer the first question is the Solicitor General. Thank you.
So I can assure you that the Provincial Operations Centre, POC, has been working directly with many communities that have historically assisted when and if there are spring runoffs. And that work is ongoing, has been going on for a number of months. Frankly, it is one of the reasons why we made sure through the Operation Northern Remote Immunity that we made sure those 31 remote communities, including Moosonee, were one of the first groups of communities to be inoculated, vaccinated. So yes, we are working with many different municipalities if and when spring flooding occurs. Thank you.
Last question.
From Patty Hendeside at AM 800. Please go ahead.
Patty?
Hello, Premier. Thanks for taking my question.
Thank you.
The Windsor pharmacies today, the appointments they put out, they've started taking appointments this morning. They were filled within minutes, and there's waiting lists now. Is there enough of the AstraZeneca to immunize the 60 to 64-year-olds in this region in the pharmacies that they're doing now? How are those numbers there? There's kind of numbers out there, but did you look at to see how many 60 to 64-year-olds are in this region and in Toronto and in Kingston?
I'll pass that over to General Hillier. Thanks.
Thank you for the question. I don't have the numbers of the 60 to 64-year-olds in each of the regions, but here is the number differential. Our first allocation of AstraZeneca is 194,000. In that age group of 60 to 64 across Ontario, there are 1 million people. So clearly, we don't nearly have enough vaccines to do all of that age group in this first batch. We're not sure of the next arrivals of AstraZeneca, but you can be sure as soon as we get them, as soon as we know, we'll publicize that, obviously, and we'll move it to our logistics pipeline and get it to pharmacies and family doctors and carry on along that same age group until we are finished all those who are eligible and who want to have the vaccine. So 194,000 across Ontario. There are 1 million people in that age group of 60 to 64. So clearly, we do not have enough to do all of them or even close to it yet.
Follow-up?
And I'm not sure if I missed this or not, but with the AstraZeneca, will there also be a 4-month wait for the second dose like there is with the Pfizer and the Moderna, or is there enough with the people getting it as soon as it starts in a couple of days to get their second dose within a month or so?
There would be 4-month delay there.
Thanks, everyone.
And I just want to mention to the folks out there, again, I want to thank the frontline healthcare heroes and everyone that's pitched in. You know, we're getting through this, folks. We've all been through a real challenging last year, and I just want to thank everyone for doing an incredible job. And on Monday, be prepared. You know, every region, as the general said, the portal crashes. Don't panic. We'll get it back up. And we have some really great folks. I know on the back end, Amazon, one of the largest companies in the world, are supporting us, and they're used to large volume. But folks, if there's one ask I have, please, if you are not booking for anywhere from 80 plus, please do not go on the line. Please do not call that number. What you're doing is just taking away from someone that's very vulnerable. You know, if you have a mom or a dad or a grandparent that you got to go online, by all means. But let's just get through this, and we're really on a roll, and we have the infrastructure, so we're ready to go. We just need more vaccines. And the federal government, by the way, I haven't given them a shout out in a while. They're doing a great job in trying to get us as much as possible. So thank you, folks. Everyone's doing a great job. All the best.
Thanks, everyone.